And health equity to me is more than just the basic ideas of fairness, equality, and justice. I think it's about meeting people where they're at because there are so many different unique attributes that make somebody's identity authentic and real. And health equity ensures that everybody, regardless of these unique attributes, are able to be met where they're at with equal access but specialized care to make sure that they can equitably meet all of those goals and standards for themselves and live a happy and healthy life.
For me, health equity is about reform primarily, whether that be healthcare reform, political reform, social reform. It's about working towards not just an end to inequalities, but to hopefully uplift people and have better health outcomes all around, regardless of your background, sexuality, gender, race, etc.
To me, health equity means striving to access the highest care for all individuals, regardless of any like character traits or personality facets. I guess it means going above and beyond just trying to reach equality and actually meeting every individual where they are with like targeted approaches, really organizing a plan to help each individual reach that highest level of care.
Health equity also means taking action. We need active, not passive engagement and strong communities to create real change. And I feel like that is a really strong principle of what health equity means.
You know, one thing that we are doing in the state of Vermont, especially in the University of Vermont, in the public health programs, we are committed to making the healthcare system work better for everyone, especially the marginalized groups. And one important thing or way that we are doing this is by addressing the disparities that prevent people from living their healthiest life, right? So we are developing new courses and leveraging the platform for everyone to take those type of courses. How are we doing this? We are partnering with the local organizations, the national ones and international organizations, especially to gather data and evaluate them, design innovative programs, and invest in communities across the state of Vermont with the goal of closing the gaps and improving health equity. Now, how are we going to do this practically? By taking these new courses. This is a course that opens the horizon of the student to openly talk about migrants and maybe seasonal agricultural workers, what we call MSAWs, easily. This is a program that opens their horizon to talk about topics that we never maybe experience in our normal classrooms, like the impact of child obesity, oral health, or the impact of oral health, the impact of, let's say, infant mortality, right? This is a program, the course that when you take, we talk about understanding the impact of urban education and urban health. There are so many topics that we dissect, we critically analyze, we make sure that we connect those topics to ourselves because as much as we know the pains of the people, we are able to advocate for their right for health equity. So we are inviting you to join us in discussion of this program as much as we find solutions in the community as we connect to them. At the end of the day, you will be happy that you are part of the change that we are talking about. And you are going to make the change yourself as much as we discuss and plan together from the beginning. And I hope to see you. You will never regret this course. Foundations of Health Equity, 1900 is the course number. I hope to see you there. Thank you.
And furthering knowledge on health equities, how to combat them both as a medical professional, but also just as a civilian, how to stand up for people in your communities, how to advocate for change, how to recognize inequalities, how to communicate effectively with peers, with people in positions of power. I think this class is just a very well-rounded introduction to health inequities and how to combat them.
if you're going to be working in the healthcare field, you absolutely need to understand the system that you are working in. And this class is certainly going to teach you that. And last up, I think it's a lot more personal than most people would expect.
Class provides an environment where you can feel safe to talk and to grow with each other, and it's a space where people can feel comfortable to explore different ideas and be honest about what they do know and what they don't, so that everyone gets a real authentic way of learning and a way of growing in this material.
It's also important to bring your own experiences to the course, and I think that helps enrich it a lot. Having people from different backgrounds with different experiences, it brings a lot to the conversation and inevitably enhances the experience for everybody involved.
This class will teach you not only about the importance of health equity, but also deepen your sense of empathy and spark a craving for justice. At least it did for me.